Before we begin with our last speaker for the morning, I just want to comment that there is a conference room right outside. I think it's the Catalina room that we have reserved. So during the day, if you want to meet and have discussions, there are tables and chairs in there to have sit-down dialogue, so you don't have to stand around. And then, of course, there's always the courtyard outside. For our last speaker this morning, I'd like to introduce Dr. Marlon Bailey. He's an assistant professor of gender studies and African American and African diaspora studies at Indiana University in Bloomington. He is doing amazing things. While we had the break, I was just asking him about his book, which will be coming out soon, and I will let him tell you about his research.
Now, I am going to get you for making me follow Dr. Wyatt. I don't know how I'm going to overcome the beautiful, incredible performance that, or presentation that she gave, so I'm going to try to do my best. I do want to acknowledge, because we have talked about the importance of nurturing future Black scholars in this area, and I want to acknowledge my organization that has nurtured and mentored me, even after earning my PhD, mentored me into HIV prevention research. I want to acknowledge and have members of the Black Gay Research Group who are in full representation, well, partially full representation today, so that people in the room can see who they are and talk to them and connect with them. So if members of the Black Gay Research Group, if you could stand for a moment so that you could be recognized. One of the really important things that I have listened to today, and heard today, I should say, is the real necessity of approaching HIV/AIDS research, prevention research, from an interdisciplinary perspective. And I come to the study of this epidemic and its impact on Black communities from a very interdisciplinary but very interesting and unique perspective. I'm a cultural theorist, I'm a performance ethnographer, I'm also a performance artist, and I have been conducting what we call performance ethnography with the house ball community, or what we refer to as the ballroom community, for going on 10 years, which is the topic of my book. Butch Queens Up in Pumps, Gender, Performance, and Ballroom Culture in Detroit. And it is going to be published by the University of Michigan Press as soon as I get it done. I'm working on that. I'm thinking it's going to be out in the bookstores by 2013. The book publishing process, the academic book publishing process, is a very long and extensive and involved process, as I'm sure most of you know. Most of my publications, and there's a piece that I authored in the program that I provided that really serves as the basis of the conversations that I want to have today about this approach, or what I'm calling a new epistemology of HIV/AIDS, the way we think about HIV/AIDS and the questions that guide our research, is moving from an intervention model to an intravention model, strategies that emerge from within communities that I will talk about later. Most of my publications have looked at the intersections of this ballroom community and HIV/AIDS prevention. An extensive amount of my ethnographic work involved examining performance practices within this community and the community structures around kinship and balls and kinship and gender identity, and how this can be drawn upon for HIV prevention strategies. And I also recently I was the principal investigator for the HIV, STD, STI, and viral hepatitis prevention and MSM needs assessment for the state of Indiana. So I do a wide range of things that I sort of mobilize around a multitude of research perspectives. I do want to point out that there is no current official, or Debbie has not touched the ballroom community yet officially, but there's a lot of work happening to actually change that. I do want to acknowledge the MoCA Center's Project Vogue that is doing some really incredible work on trying to build a intervention for this ballroom community. But what I want to do today is I want to have a conversation about what cultural studies can contribute to HIV prevention and how it can help us kind of rethink the undergirding logics of HIV prevention. And so I'm just going to lay out a kind of framework that I speak to extensively in the article that you have there, and then talk a little bit about ballroom and then open it up for questions. Okay, now this PowerPoint thing, I'm kind of new to this. The who arrow? I did. Uh-oh. I never knew. Did I do something wrong? Okay. Oh, sorry. Okay. So one of my objectives today is to examine what I call the epistemology of HIV/AIDS. In other words, what are the underpinning logics that inform our prevention research? At the NASEM conference and the BGRG Institute in New York last week, we talked about the need for a paradigmatic shift in prevention and research policy, and I am proposing, as I do in the article that you have, a radically interdisciplinary cultural studies approach to HIV prevention. And this would help us design intravention strategies for prevention that emerge from within communities, I would suggest, from within marginalized communities. And I think that we need to rethink the way we talk about culture and serve as a way to better understand what ballroom culture actually does and the potentials thereof. Now, what do I mean by interdisciplinarity? I draw from a whole range of literatures, of feminist cultural studies, people like Paula Treichler, whose book, How to Have Theory in an Epidemic. I want to just point out, I'm currently teaching a course at a graduate seminar at Indiana University that is called The Cultural Politics of HIV/AIDS, where we look at a variety of ways that we can come at and raise questions about HIV prevention, or HIV, the epidemic, and prevention. Feminist cultural studies, gender and sexuality, black political science. I use a lot of Kathy Cohen, The Boundaries of Blackness. Many of you are familiar with that text. Human geography, that really looks at the way in which spatial arrangements and social policy and policy decisions have impacted black people in particular's susceptibility to HIV infection and how it coincides with those social networks. So I also look at the history of other diseases. Samuel Kelton Roberts' Infectious Fear is a history of TB in black communities, and the history of TB in black communities looks very familiar to HIV prevention. Susan Craddock's geography of TB in San Francisco and the Asian American community. So I look at a whole range of text to think about what we are currently experiencing today. Stephen Epstein's medical sociology work, and as a performance ethnography, I look at performance, black theater and HIV, and critical race studies. Some of the scholars in here, Greg Millett and my friend Chandra Ford, have done some work on thinking about race and the impact of race and race analysis to HIV prevention and public health. And then I'm very thankful to my BGRG friends and colleagues, people like Ernest Hopkins, who have educated me about policy, HIV policy, and the way we can rethink policy. In an article that's made up of commentaries by HIV prevention researchers and workers, it was an article that appeared in 2009, Social Theory and Health. Judy Auerbach, who is the Vice President for Research and Evaluation at the San Francisco AIDS Foundation, suggested that new research, and she's encouraging this trend, new research, it has come to a realization that the social and cultural contexts matter in HIV epidemics and the responses to it. Social and cultural theories have been helpful in describing the dynamics of epidemic, but it hasn't been so helpful in guiding our responses to them. And I would argue that that's because we have not used cultural and social theories to actually guide our approaches to the epidemic and the questions that we ask. So what we think, we have talked earlier about, Dr. Karanga and others have spoken to, some of the issues that are concerning culture and particularly Black cultures. But one of the things that I think that we have to consider is cultural studies is a field that focuses on the ways in which both dominant cultural institutions discipline populations and maintain social orders. We can look at public health as one of those institutions that has power, that has monopolized the production of knowledge about HIV/AIDS, and has tended to be somewhat disciplinary and hierarchical. But we also want to think about the ways in which culture is a generative space for social struggle, for people who are multiply marginalized to affect social change. So what cultural theorist Juanima Lubiano argues is that cultural studies focuses on the interstices between the structures of material life, economic and political, and we can think in this case, HIV/AIDS, the epidemic, that determine the limits of human existence and the means by which people imagine, or I would add reimagine, their relationship to their lives and create and engage in the production of the production of new forms of living that inform that come from that imagination. So there's an issue around what I'm interested in is what do people do under the constraints that they find themselves. Members of the communities with whom I work, they don't just sit around and wait for institutions to come and tell them how to live. They create new forms of living and new forms of existing under the constraints in which they exist. So when we think about culture, we're also thinking about language and meaning making. We think about power, how power and power relations exist amongst marginalized communities as well as between marginalized communities and dominant society. We think about the way in which, for example, HIV/AIDS is represented and whose bodies it's attached to, values, the value systems that really guide the responses within communities to HIV, and particularly communities that are disproportionately impacted. And we think about practices amongst a whole range of other factors. So there are two primary points that, because I don't have time to go through it totally today, well, actually, there are two primary points that I'm going to talk about in three kind of categories. One is that I think recent concerns about cultural studies and how this helps us think about HIV/AIDS is that we think we need to think about power. I think a lot of our discussions do not talk about power and power relations and the way in which people negotiate power relations, the way in which institutions impose itself on communities. So how do social cultural institutions discipline populations and maintain social order? And then community practices, how do everyday people, marginalized community, challenge, negotiate, and transform institutional power? And what are the transformative possibilities in communities making culture? And this is a primary point from which I start, is that I think about culture as generative, as transformative, and people make culture, it is not necessarily imposed on them.